Hello my people, I'm Mary with Rooted Vigor, and today I will be dropping a video explaining to you the introduction of a new video segment that we will be starting on our channel called Rooted in Health Topic of the Day. The goal of this segment is to provide you with a brief summary of information regarding a specific health condition that affects many people in this world, especially those in the underserved community. In this segment, we will try to provide you with as much information as we can in a short amount of time, because after talking for more than 3 minutes, I do get tired. So with these videos, I hope you are able to grasp as much information as you can. So let's get right into it. So, Rooted Vigor Health Topic of the Day is GERD. And yes, that is a mnemonic of the actual condition. GERD is also known as, or best known as, Gastroesophageal Reflux Disease. Big fancy words. This is not even pertaining to anything that I should be talking about, but when you say GERD, it kind of sounds like a wet burp. GERD. So let me tell you what GERD is. You ever had that funny feeling after eating spicy food? Sometimes it would feel like there's something liquidy coming inside your throat, and it feels like you're practically on the verge of throwing up. Yeah, that's probably GERD. So GERD affects 45 million people in this country. It is a condition where food and stomach acid rises up into the mouth from the esophagus. Symptoms of GERD may be frequent heartburn, sour or bitter taste in the mouth, sore throat, constant coughing, difficulty swallowing, and belching. If you were to visit a medical clinic or an emergency room complaining of these symptoms, pharmacological treatment for GERD usually includes a proton pump inhibitor like Protonix, or a histamine 2 receptor blocker such as Pepcid. However, chronic use of these medications may cause electrolyte imbalances and GI upset. No matter what the issues are, GERD often responds very well to dietary, herbal, and stress reduction therapy. But if you are having these symptoms, it is still best to be on the safe side and ensure your diagnosis to prevent more serious conditions. Okay, so here's the fun part, the recommendations for alleviating the symptoms associated with GERD. Tip number 1, cut back on the processed foods, such as chips, cookies, or instant noodles. Also, avoid saturated fats, red meats, thickened sauces, fried foods, and greasy foods. These things take longer to digest, and they tend to linger in the stomach longer than they should be, which may increase the chance of regurgitation. Also, try to avoid excessive caffeine intake from coffee, alcohol, spicy or minty foods, citrus foods, chocolate. I know that's going to be very hard for a lot of you. And stop smoking. All of those things are capable of irritating the stomach. So instead of intaking those things, fix it with whole foods such as fruit, vegetables, whole grains, and raw nuts. Tip number 2, avoid overeating by planning several light meals throughout the day. Try not to eat until you're full, but instead eat until you're comfortable. And if you are comfortable with being full, then just don't eat. Just kidding. Another smart tip is to avoid eating for 2 to 3 hours before laying down. Try to remain upright within that time frame. Laying down makes it easier for stomach contents to rise and make digestion a little bit harder. Tip number 3, drink more water. This will dilute and neutralize stomach acid and other contents and reduce the risk of heartburn and regurgitation while keeping you hydrated. So those are my simple, quick and easy 3 tips. And as usual, you know your girl has to include some of her favorite remedies. So my 5 recommended alternatives are licorice root. It works to soothe and heal the lining of the stomach. Aloe vera juice. It promotes healing as well and also soothes the digestive tract. Orange peel extract. It works to reduce heartburn. Slippery elm. It reduces the inflammation that may present in your esophagus and your stomach. And also, last but not least, take a probiotic. Most probiotics contain good bacteria that helps you to improve your digestive function. My favorite probiotic actually comes in the form of a drink, and it is kombucha. But there are many other options in the form of tablets, capsules, tinctures, and even foods. Foods such as cultured veggies, kefir, yogurt, apple cider vinegar, and even tempeh have plenty of good bacteria. So there you have it. Reducing the occurrence of GERD reduces the risk of scarring, ulceration, hemorrhaging, and even cancer. There is no cure for GERD, but luckily the symptoms respond very well to dietary, herbal, and stress reduction therapy. Lucky you, you now have what you need to go forward living with gastroesophageal reflux disease. Just keep listening to your body and don't forget to drink your licorice tea. So our message to you, know yourself, utilize healthy remedies, and take control over your body in order to potentiate positive health outcomes. So thank you for tuning in to Rooted Vigor. Follow us on Instagram at Rooted Vigor, like and follow our Facebook page, Rooted Vigor Holistic Health, and look for us on Twitter at Rooted Vigor. Thank you. Have a great day.